Hello, today Group 6 will be presenting about our topic all about COVID by Melissa Gill, Brianna Navarro, Jensine Yu, and Michelle Martinez. So the issue our group came up with was how effective are the current treatments at reducing the impact of long COVID?
So moving on, we're looking at figure 4, and we decided that taking antiviral drugs can help reduce the risk factors and even help prevent the symptoms. So looking at the graph, we see that antiviral is below 0 to about 20, showing that the risk factors for persistence of any symptoms associated with COVID-19 is minimal with the antiviral drug as compared to the other symptoms.
So moving on to figure 6, one of the COVID symptoms that impact people with COVID is anosmia, which is the loss of smell. And based on the bar line graph, when the treatment group and control groups are diagnosed with COVID-19, they have severe levels of anosmia and hyposomnia. After 20 days of treatment, a little more than half the treatment group gained most of their sense of smell and had fewer cases of severe hyposomnia and anosmia. Compared to the control group, which had no treatment, they still had not regained their sense of smell after 20 days. After 40 days, a little more than half the treatment group fully gained their sense of smell, and the others had a good or average sense of smell. Comparing once again to the control group, after 40 days, people had somewhat gained their sense of smell back, while the others still had little to no sense of smell. It shows that receiving treatment while diagnosed with COVID can reduce or fully cure some symptoms. Moving on to figure 7, the treatment, when receiving treatment when diagnosed with COVID-19, patients are less likely to feel the impact, so like how bad they feel the symptoms. So our conclusion was that also receiving certain treatments while you have COVID-19 can reduce the ability for you to feel the symptoms.
And in conclusion, with treatment, COVID-19 symptoms are easier to handle and symptoms usually fade quicker. They usually subside within a few days or even a couple weeks if you keep the medication consistent. And our call to action is using antiviral medication while exposed to COVID-19 is really recommended. If you want to feel better, take medication as soon as possible.